Web Now, the number 1 is the number. AmericanEagle.com is the website. 1-877-WEB-NOW-1 is the number.
Rocket Mortgage is giving away millions during Super Bowl 55 with the Rocket Mortgage Super Bowl Squares Sweepstakes. See rules and enter for free at rocketmortgagesquares.com.
8:36. Let's get an update on the roads this morning in the Team Hochberg Traffic Center. Here's Jim Talamonte.
Roads may be slick, especially north, with temperatures hovering right above that freezing mark. In Woodstock, we see delays on 176 eastbound from Sunnyside to Dean. There's a rollover. Volo, there's a crash on 60 at Wilson. In Mount Kennedy, your delays are from Nagle to Central and Fullerton to the Burns Circle. The travel times come down a bit. It's 26 minutes O'Hare to downtown. 14 from Montrose, 9 in the Express. Outbound 20 minutes downtown to O'Hare. Inbound Eisenhower, 35 minutes, 390 to downtown. Outbound 29. Stevenson, 29 minutes from the Veterans Memorial Tollway to Lakeshore Drive. Outbound 28. Inbound Ryan at Cermak. There's a crash on the right shoulder. 20 minutes from 95th. I'm Jim Talamonte on AM 560, The Answer.
Chicago's Morning Answer continues next. In our AM 560 Weather Center, clouds and sun, 43 today. Considerable cloudiness, 32 overnight. Partly sunny, 34 at O'Hare. Your next news update at 9. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
From the Matrix Home Solutions studios, this is Chicago's Morning Answer on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, and your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Top of the morning, Dan and Amy, the Wall Street Journal editorial board opining something that we've known for some time, but clearly bears repeating in the direction of our nation's governors, apparently. The risk of severe illness increases with age, which is why the administration, the Trump administration, was right to urge states to administer the vaccine to anyone 65 and older. By one estimate, a 70-year-old is about 4 times more likely to die than a 60-year-old and 7 times more likely than a 50-year-old. Age is also a bigger risk factor than underlying health conditions like diabetes. There's no reason a 25-year-old teacher or grocery worker should get a shot before a 65-year-old. The development of COVID vaccines in record time is a tribute to private innovation and political will that cut through bureaucracy. The vaccine distribution has been an example of too much political interference. And the argument being disseminate the vaccines based on age, not based on profession or other political calculations like equity and arguments about historic injustices and so forth. What they're describing isn't happening is one of the reasons why 27 million doses of the vaccine have been distributed and 9 million have been deployed.
Oh, my gosh. And did you hear what they're doing in Oregon? Now they've decided, the governor there decided, teachers first before ages 65 and older. And the elderly there are not happy.
For more on this and a reaction to these realities around the country, like the one in Oregon, where teachers are being prioritized, regardless of age, being prioritized over seniors, pleased to be joined by Dr. Joel Zinberg, Senior Fellow at the Competitive Enterprise Institute in D.C., and an Associate Clinical Professor of Surgery at Mount Sinai Hospital in New York. Dr. Zinberg, thanks for joining us again. Appreciate it.
Good morning. Happy to be here.
What about that? Let's do this by age and chop.
Well, I wrote an article about this in the magazine City Journal on Monday, arguing this exact thing. The federal government did a fabulous job of facilitating the development of new COVID vaccines in record time. But unfortunately, the state governments have done a really poor job of getting that available supply into people's arms. And the problem has been they've been too focused on trying to micromanage everything, and they've got a bunch of restrictive rules over who can be vaccinated, and they've just been administratively incompetent, so that we have these millions of doses sitting in the freezer and not being administered to people.
But, I mean, it's so mind-numbing because they set these rules. Why can't they break the rules and change them? Like these phase 1A, where it's supposed to be, in Illinois, it's 850,000 people. Well, not all the people in phase 1A wanted to take the vaccine because they're young and they're healthy and they're, nurses, some doctors. So why not, just change the rules? Why are they being stubborn?
Yeah,
so
that's exactly
stupid.
the problem. And, in states like my state, New York, you have the governor putting hospitals who are trying to administer the vaccines in a bind. He says you got to use them in 7 days, but you can't give them to anyone out of this highly restrictive order. So at the end of the day, they're left with vials. They don't know what, they've already opened the vial. They have to use the doses because they'll go bad, but they may suffer a fine from the New York State government if they give them to the wrong people. So, what's been happening up until he said that, it was they were just pulling anyone in because it's better to use it on someone than to throw it away. But then you have these crazy rules that put you in legal jeopardy for doing that.
They've also, from some of the reporting and commentary I've read, including from you, the problem of taking a Politburo-style approach, centralizing it at the state level rather than leaning on the private sector health infrastructure you have with hospitals and pharmacies, not to mention at the local government level where you have county plans that have been crafted and tested in advance of something like this that in states like New York have been end run per the governor.
Right, and in New York, the county executives around the state are up in arms because every year they are required to have mass vaccination plans, and they practice them and they publish them. And now the governor and his minions have decided that that's no good. They know better, so they circumvented all of those, and they're not giving out the shot. So, there are a lot of people saying, like me, as I wrote on Monday, saying, why don't we just rely on the facilities we have, the facilities we use every year to give influenza vaccines? Every year about half the population gets a flu shot. Why don't we use those same things? Doctors' offices, other medical facilities, those account for about half of the influenza vaccines, and then about a third are given in pharmacies and supermarkets and grocery stores, and about 15% are given in the workplace. But a lot of the state governments want to centralize it in their facilities. And perhaps even worse, the incoming Biden administration is talking about they're going to start some new federal vaccine facilities, and as if this is going to happen overnight. And it is going to happen overnight. So
I'm sorry to interrupt. I'm sorry to interrupt, but the other thing about this, the infrastructure you're talking about, it just seems to be such a common sense thing. So my doctor's office, my pharmacist, these are people I also have a trust relationship with more than telling me to go to Soldier Field to get it vaccinated. So it also helps you get over any hurdles you have in terms of questions about the safety or other questions you have about the vaccine. Well, my doctor for 30 years is telling me I should do this, and I can get in and see him, or my pharmacist is telling me I can do this, and I know my pharmacist. So it just seems like that's exactly the process you would want, is people that have trust relationships communicating information about this.
Absolutely. And, there will be some issues vis-a-vis the Pfizer vaccine because it requires this ultra-cold storage, so that may be limited to certain specialized things like a big chain like a CVS or a Walmart could maybe accommodate them, or certainly hospitals. But the Moderna vaccine doesn't require that ultra-low temperature, so it just requires regular freezers. So doctors' offices and other places can easily accommodate that. Plus, we're going to likely have some more vaccines coming online in the next few months. The AstraZeneca vaccine, possibly the Johnson & Johnson vaccine. So, even the two existing makers, Moderna and Pfizer, have said they're going to have 200 million doses in the first quarter of the year. That's enough so that we can relax the rules, set an age requirement. The government finally came to its senses and said 65. I argue you could, as supply gets bigger, you can possibly go even lower. You go down to 45 because only 2% of the COVID deaths are in below age 45. So we really ought to be thinking about vaccinating everyone above 45 eventually.
So, Dr. Zinberg, what are known side effects that you've been hearing of and researching? Has anybody died from taking these vaccines?
No one has died that I'm aware of. There have been a few instances of severe allergic reactions, but now most places, when they're giving the vaccine, are requiring people to hang around for 10, 15 minutes to make sure they don't have this severe reaction, and they have precautions in place to take care of those reactions. The more common side effects are relatively minor. They're things like headaches or muscle aches, maybe a chill, maybe some fatigue, but there's certainly nothing life-threatening for the vast majority of people.
There was this case out of Miami where a doctor there allegedly died after, as a result of the vaccine. Certainly he died after receiving the vaccine shortly thereafter. That case is under investigation, but your point is well taken.
One of over 9 million doses.
No, I understand. I understand. Your point is well taken, but I just wanted to raise that issue. To talk about cases the same way, frankly, we talk about the anomalous COVID case and put that in perspective, but I don't want to ignore it.
Right. No, I don't ignore it, but the fact that it's one of 9 million makes you think that it could be completely coincidental. You really have to investigate the circumstances.
With respect to those who are doing it right, so, for example, the Dakotas, in both South and North Dakota, they have distributed 70% plus of the vaccine doses that they received. Are the Dakotas doing what you're suggesting, where the other states that are under a third distributed or a third or less distributed are not?
Well, I can
Is it that simple?
Yeah, the Dakotas and West Virginia, and I could tell the West Virginia governor has come out and made very clear that what he and his state government set up was to rely on their pharmacies, and they set up an advanced utilization of the National Guard. So I'm not against the government if it's going to do it correctly, but it should have been obvious to every state in the country, not just to West Virginia, that a vaccine is coming. We've been talking about vaccines for 6-7 months already, and to set the mechanisms up. So West Virginia set those mechanisms up, plus it's relying on the private entities that we normally rely on, and that's what we should do. But you can't now have governments scramble and say we're going to set up mass vaccination facilities when we didn't have them set up before. If they haven't done it, they should step aside and let the private entities that routinely do this carry the ball forward.
Our going to have the Illinois National Guard do inoculations here, but 200 had been sent to Washington, D.C. to protect the Capitol for Joe Biden's inauguration. And our governor has said he's going to wait until after Biden's in office. So that's when it becomes political. Don't you think that this has become a politicized vaccination process?
No, I think the whole thing has been politicized from the get-go. The Biden campaign and scientists allied with the Biden campaign were creating public doubt about the safety of the vaccine development process. So as a result, you've had an uptick in people who are wary of being vaccinated. And Governor Cuomo in my state of New York was saying a month or two back that he was not going to allow an FDA-authorized vaccine into New York. He was going to insist that it be approved by New York, and he lamented the fact that it might actually be distributed under a Trump administration rather than a Biden administration. So it's been highly politicized, and in a way that's harmed the public health.
Isn't it interesting, too, the sense of urgency and the coverage of said sense of urgency, comparing lockdowns versus vaccinations? The sense of urgency about locking people down, the lack of a sense of urgency, it seems, about vaccinating people, even though with each passing day that